Hello, my name is Lorna Ramsey, and I am a teacher in Canada and the UK. I've had experience teaching in Canada with alternative schools, in special education, gifted, and learning disabled children. I've worked in the public school system, assisting with special education needs and special programs. I'm currently working as an instructor at Simon Fraser University in Foundations of Literacy, and I have assisted in courses for 4 years in behavior management, taught a course in behavior management in classrooms. The university. In the UK, my experience has been in 2 year 1 classes, and I have set up individual programs for special needs kids within those classes. Both of those classes were being prepared for Ofsted inspections, so I worked very closely with the staff, and in both cases the school passed. So it was a very wonderful experience, but very hard work, and I certainly got an idea of the UK system there. In my work at the university, in my graduate studies, I have studied the UK curriculum as well. So I do know the UK curriculum very well. So I've been teaching since 1985 in different positions.
All right. As you can imagine, Lorna, behavioral management techniques are quite crucial in any teaching job. What would you do if a child refused to sit down or do any work?
This would be dependent upon the child's history and our relationship and our understanding of expectations in the classroom. If the child did have a behavior program, then the expectations would be that he or she would continue with that program. So what we would have to do is speak to the child directly and try to engage him into the process and remind him of the behavior management program that he was involved in. That I would do when the other children were settled, and if he was being disruptive, of course, I would have to deal with it immediately. If there was not a behavior program for that child, then it's just a matter of speaking with the child and asking what is on their mind, what they would think would be appropriate for that moment, and what they might decide to do as an alternative. Give them choice, give them responsibility. I like to place the agency to them. They're the responsible learner. I think that they make the choice, but I provide the options for them if they need the guidance.
All right. At what age does testing take place in your country, and do you make use of exams or continual assessment?
There are both continual assessment and exams once you get to about 10 years old in this country. The 10 years old, they're starting some type of formal testing, but there's a continual evaluations going on as well.
All right. What size classes do you normally teach, and is it a mixture of boys and girls?
A mixture of boys and girls, and it's around 20, sometimes less. In the alternative schools, there'd be about 12, and then there would be the smaller groups that I work with alternative approaches, arts education, integrated arts education.
All right. Lorna, can you just explain a bit about your special needs experience?
Yes. I became interested in giftedness and was studying it at school. I also have a son who is gifted, and I worked in gifted schools, schools for gifted children, beginning in the 1990s. And I've had short contracts with them, and I've worked as on-call as well. These children are gifted, but they also have other needs, learning disabilities and visual problems in one school. Another school, there were autistic spectrum children as well. So when I was hired in the UK, I went to a behavior management course there because of my background, and I was able to reinforce a behavior program that was already in a school in Colchester, and took 6 children and put a separate behavior management course for them as well. So those children have multiple needs, emotional problems, but there's oppositional defiance disorder, Asperger's, and so there was a variety of need. There were varieties of needs in the one group, and I was able to work with all of them at the same time with a behavior management approach. The other classroom had Down syndrome and autism and emotional disturbance, autistic spectrum, and I was working with all of those children at the same time as well.
All right. Do you have anything else to add, Lorna?
Right now I'm looking for a position with primary children, with the younger groups, but I can work with older groups as well. I have experience teaching at a college level, and my emphasis is on working with special needs. If I'm in the classroom, I'd like to perhaps work in a more managerial role and organizing programs for special needs children. I'd like to work eventually with college and teacher training programs. So there's a direction that I'm going with my job search right at the moment. Thank you.
All right. Thank you.